I'm here today with Dr. Brenda Gorman, Assistant Professor of Speech-Language Pathology at Marquette University. Dr. Gorman is also the Advisory Clinical Director for LinguaHealth. Brenda, thanks for coming out today to talk to me about speech-language pathology issues.
Thanks for having me.
Brenda, you have the good fortune of working in a university clinic, and you're meeting a lot of graduate students that are deciding on what they're going to do with their lives, where they're going to go with their professional path. What are some of the words of wisdom you can give a student that's thinking, should I work in a hospital? Should I work in a school-based setting? What are the differences? Anything that you can elaborate on would probably be helpful.
The first recommendation I would have is based on personal experience. I recommend being open to all the possibilities. I went into graduate school convinced I did not want to work with children. And what do you know? I ended up working with children and loving it so much and never looking back. I think the main determinants are the age group you want to work with, as well as the type of disorder, whether you're more interested in working with acquired disorders of adults or developmental disorders of children. There are many similarities between settings. There's a lot of variety in both types of settings in the types of disorders that you see. You get to work with other professionals in both settings. With hospitals, you might work with doctors, nurses, ENTs. In schools, you work with teachers, special educators, counselors. So it's both have a wonderful opportunity to continue learning and collaborating. In terms of the pace, that varies quite a bit. It depends on caseload. Some SLPs in hospital settings have a very fast pace. Others, perhaps if it's more of a non-for-profit facility, might feel a little bit less of the push for pace. Many SLPs have much more contact with the families in hospital settings. That part is more difficult in the schools. In terms of the school setting, you have more vacation, certainly. Schedules, you often tend to start earlier in the day, which means you get out earlier in the day, which is an advantage as well. Many SLPs, and I myself included, because we were done early and wanted additional opportunities, there's time in that early afternoon or early evening to get experience elsewhere if you want a little bit of both worlds. Hospital-based SLPs, many work on the weekends as well, perhaps every other weekend or once a month. So those are some of the differences that I think of.
I know that obviously in hospitals you have nonprofit hospitals and you have for-profit hospitals. The funding source comes from a different stream than a school district. Mm-hmm. So maybe you can talk a little bit about how those sources affect service delivery.
In terms of the funding source, that can impact SLP's experience. In hospital settings, again, if there is a productivity requirement tied to billing purposes, some SLPs can feel the impact of that. In clinics as well, I recall often insurance companies tell you how many sessions you can get with your client, and when you hear, boy, I've only got 16 sessions, that can create a lot of pressure. In the schools, you don't have that per se. You have caseload requirements, and of course that caseload size is influenced by funding sources as well. It's a different sense. I don't think SLPs often feel the direct impact of funding sources as much.
Brenda, I know that when you were in graduate school, your initial idea was to become a clinician that worked only with adults. You really weren't interested in working with the pediatric population. Ultimately, you ended up working with children. How did that change happen?
Yeah, it still surprises me how, again, I was convinced I did not want to work with children, but what happened was I had such a wonderful school experience during my practicum. I loved my supervisor. I did not realize how much fun working with children would be. It was a lot more fun than I had expected. And I think another reason, to be perfectly honest, was I didn't think I would be good at it working with children, but I ended up being good at it. And again, I had so much fun. That was one thing about kids. They love whatever you do, and they love you. It's just so easy to love working with them. So that was definitely part of the reason that convinced me, but the number one reason was really that I wanted to work with Spanish-speaking clients as much as possible. And so for that reason, it was an extremely easy decision because those jobs working with children are quite plentiful. And they exist with the adult population as well, but there aren't nearly as many as there are working with children. So the fact that I had a lot of fun working with kids more than I thought, the fact that I wanted to work with diverse populations as much as possible, that made it an easy decision for me.
Well, Dr. Gorman, thanks for sharing your insights. Hopefully graduate students will keep their options open and keep their mind open when they're in graduate school and seek out different experiences because they really never know where they'll end up working or what they'll end up like doing.
My pleasure, John.